So, what is COPD? COPD is a chronic lung disease that is preventable. The disease can include both chronic bronchitis and emphysema. These cause a blockage of the airway, manifesting in the clinical presentation that we see. This disease affects about 16 million Americans each year. Unfortunately, there is no cure, but it can be treated. What causes COPD? COPD is caused by chronic exposure to lung irritants and damage, leading to the destruction of the alveoli themselves, and or the narrowing of the bronchi from chronic inflammation. Over time, the airways narrow, leading to difficulty with exhalation, and air remains within the lungs, causing some of the symptoms. Patients may present with barrel-chestedness, difficulty breathing, shortness of breath, chronic cough, production of phlegm and sputum, frequent infections, weight loss, edema, wheezing, and so on. Some of the risk factors for COPD include exposure to air pollutants, potentially on the job or through other sources like living conditions. These can include dust, fumes, and chemicals. Chronic smoking or smoke exposure, usually from cigarettes, can also cause COPD. Genetics can play a factor along with severe lung infection. So today we're going to be presenting a video. Let me just present the scene for you. So Mr. Jones is a 70-year-old male presenting with shortness of breath to the hospital and a chronic cough. He was a smoker for 40 years, smoking 1 pack per day. He worked for 30 years in a paint factory that did not provide proper ventilation or air filtration. We see Mr. Jones laying flat on his bed with an O2 monitor hooked up to his hand. You see his pack of cigarettes next to his bedside, along with some McDonald's. I'm struggling to breathe. I feel so full. I live alone, and I just can't do this anymore. I wish someone would help.
What? Emergency? We're on it.
I'm positioning Polly. All right, Mr. Jones, let's get your head of the bed up there. Going up. All right, let's try something called the tripod position. Gonna have you put your arms up on the table and lean forward. Going up. Take some big, deep breaths. All right, Mr. Jones, how are you breathing?
A little better, but not great.
Okay, let's try pursed lip breathing. So shape your mouth like you're gonna whistle. Now breathe in through your nose and out through your mouth, nice and slow. How's that?
I'm feeling better already.
The first nursing interventions that we are going to discuss are raising the head of the bed, the tripod position, and pursed-lipped breathing. By raising the head of the bed into either semi-Fowler's or the Fowler position, the patient will be able to better breathe more effectively. The diaphragm can better descend in these positions, allowing for better inhalation without needing the patient to work so hard to breathe. The tripod position can also be used to help relieve shortness of breath. It is performed by having the patient lean forward and resting his or her elbows on the tray table while in the hospital, as shown in the picture on the left. This can also be performed while the patient is at home by having them sit in a chair and roll their head and shoulders forward, as shown in the picture on the right. This will help lower the diaphragm and open the lung space to decrease shortness of breath. Lastly is pursed-lipped breathing. So as shown in these photos, this is performed by having the patient shape their mouth as if they are going to whistle. They then take a deep breath in through their nose and out slowly through their mouth. This breathing technique can help control shortness of breath by reducing the amount of residual air in the lungs. The length of exhalation is extended and air pressure is increased to stop premature airway compression and reduce the amount of trapped air in the lungs. By practicing this technique, a patient can become more confident in their ability to manage their shortness of breath. For example, in a study of 68 individuals with COPD, individuals in the intervention group that used pursed-lipped breathing exercises had decreased shortness of breath and increased oxygen saturation levels compared to individuals in a control group. Patients with COPD often also partake in pulmonary rehab, where they can learn how to help control the shortness of breath and also how to perform these breathing exercises.
How you doing? It's Dr. O2. How you feeling?
A little dizzy.
A little dizzy. I heard Positioning Paulie was just in here a few minutes ago. We're going to check your O2 levels there, bud. 76, so you're getting a little better, but not too great. So I see you have some cigarettes and a lighter there. You smoke?
Yes.
Well, you can't smoke next to this bad boy. You know what happened to you?
What?
You blow a hole so big Thanos can fit through it. We're gonna put you on some O2 now, sir.
Okay.
Okay. What are you not gonna do by the tank?
Light a lighter.
Oh God, it's gonna kill us. How you feeling?
I'm feeling better already.
Mr. Jones! Dr. O2 sent me in here. I'm Smoking Cessation Sally, and this is Slimy Sam. I hear you're a smoker.
Yes.
Do you think it's cool?
That's what the commercials tell me.
Do you think COPD is cool?
That's what landed me in the hospital.
Well, smoking is the #1 cause for COPD and it affects 16 million Americans. You should probably think about quitting.
Okay. Got any tips or tricks?
Absolutely. We can try nicotine gum, patches, support groups, therapy, counseling, lifestyle changes. What do you think about that?
That all sounds okay.
Do you have any children at home?
I have grandkids.
Well, secondhand smoke increases the risk for asthma.
Wow. I am motivated to change.
How are you feeling now?
I'm feeling better already.
Great. We're going to be taking these with us. Hello. I'm Chef Beef, and I was sent in by Smoking Cessation Sally and Slimy Sam. What have you got there?
Just some chicken nuggets and a soda for dinner.
Did you know that fried foods and sugary foods are really bad for COPD?
Oh, really? My doctor says I'm kind of unhealthy.
Oh, it makes it really hard for you to breathe. You should also switch to healthy sources of protein, like almonds, at least twice a day.
Okay.
And you should switch to complex carbs like fruits and vegetables. And you should have 4 to 6 small meals a day.
Small meals, you say?
Yeah, it's harder to breathe on a full stomach.
Oh, okay. Wow, that sounds like a great option. I'll try to implement that in my life.
Awesome.
I'm feeling better already.
Nice. And if that's not enough, you can have medical or liquid supplements.
What are those?
They help fill in the gaps in your diet when you're feeling like you don't have enough to eat.
Oh, so like vitamins.
Similar, yeah.
Okay, great. Thank you for all the information.
You're most certainly welcome. Hi, Mr. Jones.
Hi,
I'm Medication Mandy. How are you feeling?
I'm feeling okay. When can I get out of here?
Actually, I'm here because you have discharge orders to go home.
That's great.
There are a few things, though, we need to go over.
Okay,
You have some medications you're going home on.
sure.
The first one is called albuterol.
Oh, I've never heard of that.
So it's a bronchodilator. It's going to help open up your airways.
So it opens up the airway so I can breathe better?
Yep,
Great.
exactly. Okay, Mr. Jones, here's your albuterol with a spacer
Oh,
to help it make it a little bit easier for you.
how do I use this?
So you're going to hold this up to your mouth, press down on the button, and take a deep breath in. Perfect. Alrighty.
Wow, that really does work.
Good. Alright, and the next medication is a corticosteroid.
Oh, what is that?
Well, here's some information. The one that you're prescribed is called Flovent.
Okay,
It's going to help decrease the inflammation in your lungs.
got it. Inflammation. I think somebody else spoke about that.
I bet it was Chef Beef.
Oh,
So the most important thing to remember is that you take your albuterol before your Flovent.
oh, why does that matter?
Because the albuterol will help open up your airways so that the corticosteroid Flovent can be more effective.
Wow, that does make sense. Okay, am I good to go then?
Sign right here.
You know what, Medication Mandy, I just wanted to say, all the healthcare workers that have been in here so far truly are superheroes.